upright, place the packages on their side, with the paper side facing down. The basket should not be too full, as the packages expand during the sterilization process, and they must also be allowed to breathe freely. A list is made of all products to be sterilized in order to identify the batch in which they were processed. The list is then attached to the batch in question. The right positioning of the baskets in the load reduces the time needed for drying. Positioning heavier objects on the lower shelves prevents moisture from dripping onto the lighter products. The sterilization cycle is selected according to the load to be sterilized. In the validation process, the cycle parameters have been optimized for different loads so that a reliable sterilization result is obtained in the shortest possible time. The sterilization cycle includes a pre-treatment phase with the aim of removing air from the chamber and the load, the sterilization phase where microorganisms are eliminated, and post-treatment for drying the load after sterilization. Easy-to-dry loads are dried using vacuum only, but air and steam pulses may also be used. Reliable functioning of the autoclaves is supported by a supply of pure air from steam generators. When the process has been completed, the printout is used to check that all critical parameters have been achieved. The process is then marked as approved. After sterilization, the packages and products must be allowed to cool down before handling, checking, and sorting them. Each product is checked as to whether the packaging is intact, the changes communicated by the process indicator have taken place, and the product is clean and dry. The process indicators printed on the packaging help to distinguish between products that have or have not been autoclaved, but do not provide evidence of sterilization. Strip indicators with a higher classification convey information on whether the sterilization process has attained the parameters controlled by the indicator. After checking, the products are sorted for storage or delivery to the ward. The products are stored in a dust-free place protected from sunlight, preferably in closed cabinets. It's recommended that the air has a humidity of 40 to 60% and a temperature of 18 to 20 degrees Celsius. Any unnecessary handling of the packages should be avoided, as this would increase the risk of contamination. In cases where the transport or storage circumstances are particularly challenging, a protective pouch made of impermeable multi-layer film can be used to protect the sterilized packages. Sets and instruments collected from the sterile equipment store for use in the procedure are registered in the data system. The sterile packages are opened in accordance with good aseptic practice. The opening and filling end of the pouch is designed for easy separation of the paper and laminate using fingers. The side seals of the pouches prevent dust from accumulating in the critical opening seal during storage. First, remove the upper corners and then carefully open the opening seal. Open the package as indicated by the symbol printed on the packaging. The opening seal is designed to guide the user towards opening it correctly and easily. Take hold of the paper with one hand and the laminate with the other hand. Open the package by pulling the laminate away from the paper slowly and evenly. Double packaging ensures safe and sterile opening. The outer surface of the inner packaging is then also sterile. Industrially sterilized disposable instruments and packaging must be used with the same diligence and care as products processed by the hospital's own sterilization unit. The aim of instrument maintenance is to prevent the transmission of infections by processing the instruments used in the examination and treatment of patients in a way that eliminates the risk of contamination. Accepted procedures must be followed in both large and small units of instrument maintenance.